Hello viewers, thank you very much for the overwhelming responses from the questions. I'll take the first question. What is acidity and how can we prevent from getting the acidity? Acidity is a very common word used by common people. It indicates GERD, that is gastroesophageal reflux disorder. What happens in this is the stomach gets the acid regurgitated into the food pipe, that is the esophagus, and causes the symptoms like chest burn, burning sensation in the throat, also in the chest area, and sometimes also may lead to the ulcers in the mouth. Dry cough could also be a symptom, and also the bad breath, and these are all the simple symptoms of the GERD or the acidity in short. How to prevent it? The first one is avoid junk food, processed food, fast food, oily, spicy food, and also excessive usage of dairy, that is milk and milk products, because they are considered to be acidic in nature. Also the fermented food, that is idli, dosa, dhokla, etc., are also believed to cause more acidity. So try to avoid them as much as possible in a routine life. The third one is the posture. While eating, also on the other side, whenever you are not eating, try to maintain the erect posture so that it will not affect the acidity part in the future. And properly work on your meal time. Try to get a proper night's sleep, which is also very important, and get rid of your stress with various other techniques of yoga and meditation to keep your the mind free, and which is also has a direct impact on your digestive system. And last but not the least, do not lie down immediately after the food, and also whenever you lie down at night time for a sleep, turn to your left side so that it will aid the digestion properly. Next, is stomach sensitivity and acidity correlate each other, and what to do to get rid of the medicines like Nexium? A very good question. Yes, the prolonged GERD may lead to stomach sensitivity and the gastritis. The same thing is explained in Ayurveda as Amla Pitta. Urdhvaga Amla Pitta, that is GERD, and the Adhoga Amla Pitta as a gastritis or a duodenitis. In your case, the best thing is to identify the right causes and address them accordingly so that the preventive factors will be taken care. And to get rid of your Nexium or any other proton pump inhibitors or H2 receptor blockers, so Ayurveda has a wonderful potent herbal medications to treat this condition successfully. In chronic cases, the Panchakarma will be much helpful. Question. I am having a loose motion symptoms since 10 years, and in result I have acidity and full stomach syndrome. What to do? See, the acidity can be very chronic in this case, and also there is a lot of possibility of a bile getting regurgitated, so that's why you are feeling the full stomach syndrome. Best thing is you need to talk to a doctor individually so that we will assess the cause and the mechanism properly, and we can address the issue very specifically. Next question. If someone has acidity problem regularly for long time, say 10 years, so what secondary or chronic illnesses can occur? Poorly maintained chronic acidity causes complications like esophagitis, duodenitis, that is inflammation of the upper part of the esophagus or the internal lining of a stomach, or the upper part of a duodenum or the intestine. It may also lead to the ulcers, the bleeding ulcers, and also may cause the secondary infections in these ulcers. And very rarely these chronic ailments may turn into a cancerous cells. The chances would be of only 1%. Next question. Will a balanced diet and a regular timing in meals prevent acidity? How much important is timing? Yes, the balanced diet and the proper timing will definitely leads to prevent the acidity. The body has its own biological clock which doesn't need any alarm. So when we stick to a proper meal time, the body secretes on its own rhythmatic way the acid to digest the ingested food material. If we miss the food intake, the body keep on secreting the acid, and in the long run it may lead to erosion of the internal lining, and that's how the acidity problem begins. So the best is to having a very proper timing at or the regular meal time. Next question. When there is no gas, burning and bloating, can you still be acidic? I take tea with lot of ginger in it. Can it cause acidity? How will I know? Here we always tell to prevent the caffeinated drink. Even the high amount of tannin, that is the normal tea leaves, are believed to produce more acidity. Along with the fresh ginger is again believed to have a more strong impact on the GI system. So the better choice would be dry ginger infusion, that is simply boiled water with a dry ginger powder or a crushed ginger junk will be sufficient enough to maintain the inflammatory conditions in the body. Will I come to know about the symptoms? If there are no symptoms regarding the acidity, so that means you are not suffering from any of the condition. But still, if you are doubtful, visit a doctor for pulse diagnosis so that you can assess the condition in a much precise way. When to consult a doctor? If the acid reflux symptoms are prevalent more than 2 times a week, then you have to meet a doctor for further evaluation. If this is a symptomatic in once in a while issue, then you can maintain your acid reflux by using the what do you call this alkaline food materials like tender coconut, fresh sugarcane juice, fresh buttermilk and bananas. These things will help to neutralize the acid environment in the stomach. Congratulations, Varsha Mane. Your question is selected as best among the others, and avail your gift coupon from Shri Shri Tattva Panchakarma.